And we're now learning the country likely had COVID-19 cases months before we first thought. It has been determined there were positive cases in January, possibly even last December. Well, that has a lot of people wondering if the illness they had back then was indeed COVID-19. CBS 4's Dylan Thomas in Greeley tonight. Dylan, you're one of those asking that question.
Yeah, Jim, back in February, I had symptoms very close to what we now know as COVID-19 symptoms, just without the coughing and the breathing issues. Well, hospitals like UCHealth here now have the ability to be able to test to see if you had COVID-19 in the past. So I decided to get that test, and I brought cameras along with me.
It's been absolutely crazy.
As testing around COVID-19 is the focal point of many area hospitals, now checking for antibodies is raging in demand.
The antibody test is if you've had the actual virus in the past.
At UCHealth in northern Colorado, nearly 2/3 of those signing up for COVID testing are actually there to see if they've already recovered from it.
I was sick. Did I have COVID? Did I not? And so I think just it is definitely peace of mind.
To check myself, I visited UCHealth, a hospital system which boasts of their FDA-approved test.
We have a 99% accuracy on the antibody testing. There's a lot of companies out there that are offering it. They can't offer that same percentile.
My name's Chris. I'll be taking care of you today.
From the comfort of my vehicle,
We do a quick blood draw.
UCHealth took one vial of blood, confirmed my patient info,
Yep, that's me.
and sent me on my way as my test was evaluated in a nearby lab.
We don't have to send those out for testing, so we have a pretty quick turnaround time.
UCHealth promises results within 12 to 24 hours. But while the test can show if you've had the virus in the past, it is still important to note.
We don't know what the antibodies having that means quite yet. It's still up in the air.
At this time, we're told it doesn't guarantee immunity, but that's definitely what we're aiming for.
While UCHealth guarantees results between 12 and 24 hours, mine actually came back in less than 2 hours. My blood was non-reactive, which means it was not positive for the virus, meaning I have not had it yet. But that does not necessarily mean that I don't currently have the virus. I would have to do a nasal swab test in order to find that out. Those who do get reactive results from their blood are encouraged to actually donate their plasma, as so far researchers believe it can actually help the people who are sick. Live in Greeley tonight, Dylan Thomas covering Colorado First.